Hello, welcome everybody. I'm Polona from EMEUNET social media subgroup. Today we are going to discuss a paper recently published in Arthritis and Rheumatology with a co-author of the paper, Dr. Sofia Ramiro. Hi, Sofia.
Hello, thank you very much
for your paper was selected for the paper of the month. Congratulations on that. And thank you very much for your time and sharing your results with us. Can you tell us what's the paper title?
Well, thank you very much for this invitation, for the opportunity to share with us the results of our study. On behalf of my colleague, Pauline Bakker, I'm happy to discuss with you some of the findings of our paper. The title of our paper is it useful to repeat magnetic resonance imaging of the sacroiliac joints after 3 months or 1 year in the diagnosis of patients with chronic back pain and suspected axial spondyloarthritis?
Thank you. First of all, we would like to know what are the expected recommendations for diagnosing axial spondyloarthritis?
Well, we do not really have recommendations or criteria for diagnosis. The diagnosis of a disease is the recognition of a clinical pattern. So we identify a pattern of symptoms, signs and symptoms in patients that we know belong to patients with spondyloarthritis. One sign that we frequently look to is the presence of bone marrow edema that we can observe in MRIs of the sacroiliac joints. And so we look at whether or not, sometimes, not always, but if a patient is suspected for having the disease, and if we don't diagnose the disease with other signs and symptoms, we may perform an MRI in order to look for bone marrow edema in these patients in the MRI. And it is when it's present and it fits in the clinical picture, it helps with the diagnosis. So one may have the question, is it important to repeat the MRI, particularly when the MRI is negative at one moment when we see the patient and we perform at the baseline moment, we perform an MRI. One may wonder whether it's necessary to repeat it sometime later in order to make then the diagnosis if that would be the case. So that was the main question that we had here.
Okay, and so you studied the repeated magnetic resonance imaging of sacroiliac joints. What was your finding?
Is that first of all, in the vast majority of the cases, in 70% of the patients always had a negative MRI at baseline and at 3 months. Only in 30% of the cases was there any change in the signal of the MRI between across the time points. And so in 13% of the cases, the MRI was positive, always positive. And in 17% of cases, there was a fluctuation, either positive or negative in any of the time points. But we realized, so it's a small proportion of the cases in which there is a change. In the vast majority of the cases, the result that we find at baseline is the same at 3 months and at 1 year. And whenever there is a fluctuation, it's only a minority of the cases that change from a negative MRI to a positive MRI. So only 7% of our cases changed from a negative result to a positive result. And what we were then interested in was also seeing what are characteristics of patients that have a positive MRI. So what is associated with having a positive MRI? Something that we already also knew from in the field of spondyloarthritis, and now we confirmed it in a cohort of patients with early suspected disease. So patients that are HLA-B27 positive, patients from the male gender have a higher likelihood of having a positive MRI compared to females and HLA-B negative. So if we look at males who are B27 positive, 42% of them had a likelihood of a positive MRI in any of the time points, compared to only a 7% likelihood of a positive MRI in HLA-B27 negative females.
Okay. Thank you. So, did you investigate maybe if any specific therapy has influenced MRI and the outcome of back pain after 1 year of follow-up?
That is a very good question, but we thought that would be out of the scope of the current study. It was impossible to take everything into account. We do recognize that, as I mentioned, there was a fluctuation in the result of the MRI and the bone marrow edema in a small proportion of the patients. And when there was a change, it was mostly going from positive to negative, from the presence of inflammation to its absence. And most likely that is because of the treatment. So that patients had, and some patients indeed had, most of the patients had NSAIDs and some have had also biological edema. So that can have contributed to the disappearance of the inflammation in the MRI.
Thank you. So considering these results, would you advise against repeating MRI after 1 year in those patients who already had a positive MRI at their first visit?
Well, I would anyway recommend against repeating MRI if it's for diagnostic purposes, independent of the diagnosis of the result at baseline. If it's positive, and if you want to make a diagnosis, then you can make a diagnosis if it's positive at baseline, so you do not have to repeat anyway. And anyway, we know from this study as well that when it's positive, it most likely remains positive. And if it's negative, that would be the most relevant question, what to do in case it's negative at baseline. And we know that only in 7% of the cases there was any change from negative to positive. So this is very little percent. So it's not worth it to repeat an MRI. And this is important for clinical practice because patients may need an MRI of the sacroiliac joints in order to make or to reject a diagnosis, to exclude a diagnosis. But then we know as clinicians that one moment making an MRI is enough, and we don't need to repeat several MRIs throughout the time because they will most likely give the same information.
Thank you. You made a really nice presentation of your work. Is there something else you would like for our viewers to know about this study?
Well, there are other things I could mention, but I think these are really the main messages. So I would rather focus on the main messages and less information, but the right ones, and expanding more. I think these are the relevant messages.
Okay, I agree. Thank you very much for your time and congratulations to your team.
Thank you very much, Polona. Thank you. Thank you for selecting our paper and for giving us this opportunity to share our paper.